Hello viewers, I am Dr. Rahul Reddy from Androcare Andrology Institute, Hyderabad. Today we will discuss about a latest therapy for erectile dysfunction, which is called piezo-wave shockwave therapy. So now, whenever there is erectile dysfunction, first thing is we have to diagnose what is the root cause, whether this is psychological or hormonal or vascular AD, we have to diagnose. This therapy, piezo-wave shockwave therapy, is a new technology. Whenever we give this therapy to the penis, it helps in production of new blood vessels so that your penile function will come back to normal situation. So now here what happens is, if patient is having psychological ED, then it may not work. If patient is having hormonal ED, then first we have to treat that hormonal ED and then we have to do this shockwave therapy. So now most of the people, they're worried about shockwave therapy. The moment they hear about shockwave therapy, they're worried about side effects. They think that some shock waves are given to the penis. This is not the case. Piezo wave therapy is nothing but sound waves. These waves, they enter the penis, they are painless, absolutely zero side effects, and safest treatment for which is available for erectile dysfunction. So now, how this therapy is done? So generally, people need 4 to 6 sessions of shockwave therapy. The gap between 2 sessions is around 5 to 8 days. It should not be less than 5 days. It should not be more than 8 days. So now, what happens when this shockwave enters the penis? See, normally you have to understand a regular healing mechanism. Whenever there is a problem, whenever there is injury to the body will send healing factors to that particular area. So these healing factors will release some enzymes which helps in healing. Some of these enzymes are vascular endothelial growth factors. We call them as VEGF factors, VEGF factors. So now, whenever there is an injury in the body, our body senses that injury, sends these factors to that particular site. But in penis, whenever the blood vessels are abnormal, body can't sense. So now you have to generate a signal for these VEGF factors to come and start healing process. So whenever you start shockwave therapy, because of the shockwave therapy, these healing factors will come there into the penis and they start production of new blood vessels. But these healing factors, they need repeated signals. So that is why you need at least 4 sessions of shockwave therapy. You should not stop in between. If you stop in between, again you have to restart the therapy. Again you have to start from first session. So after the therapy, it takes at least 18 to 20 days for the healing process to start. So now after 4th session, generally what we do is, generally company says you have to give 4 to 6 sessions. So now how we categorize is, young patients who has problem, generally they respond with 4 sessions. People with chronic diseases, chronic smokers, chronic alcoholics, diabetics, hypertensives, they need 6 sessions. So now after the new blood vessel formation, how long this therapy works? So now normal people who don't have all these above said problems, it works for 5 to 8 years. So if it works for 5 years, then again after 5 years you have to take one more session. So if for diabetics and hypertensives and heart patients, it works for 3 to 4 years. So every 3 to 4 years they have to repeat the therapy. But in a way this is a wonderful treatment, because older generations, when there is no treatment available, people have to depend on Viagra for lifelong, or if it is not working, we used to do a penile implant surgery. Now this therapy will avoid that kind of surgery, penile implant surgery for these patients. So as per current techniques, this is the best therapy which is available for penile rejuvenation, and this may not work for all patients. Your doctor will diagnose in whom it works, in whom it may not work. So viewers, if you have any doubts about this therapy, please write it in comment section, and please subscribe to our channel if you want. Thanks for viewing. Bye bye.